COVID-19 update for Thursday, November 5th. Today we mark a terrible milestone for the state of Illinois. Following our largest single-day increase in deaths since early June, Illinois has now surpassed more than 10,000 Illinoisans lost to COVID-19. Each day we are losing more and more of our neighbors to this virus. That's not a trend that's going to turn around on its own. It's up to us, all of us, to do something to save the next family from tragedy. Because unfortunately, it could easily be yours. And to all those who have lost someone to this horrible, invisible virus, I am so sorry for your loss. I am so sorry for your grief. I'm so sorry that your personal tragedy is folded into this public one. Please know that the state of Illinois stands with you. We won't let your relatives, your friends, be forgotten. Please join me in a moment of silence. To all Illinoisans, I cannot stress enough the severity of our situation. IDPH is looking at proposing further regional and statewide restrictions because the rise in cases and hospitalizations is unsustainable. But I cannot stress how important your individual actions are right now. What you do, what we all do, will determine how much worse the coming weeks will look. We are seeing record numbers of new COVID-19 cases across the state. Our community transmission rates are at drastic levels. In the last week alone, we've seen our state case positivity climb from 6.9% last Thursday to 9.1% today. And our test positivity, which we use for mitigation decisions, similarly climbed from an average of 8.2 then to 10.5% now. In 1 week. Yeah. 1 week. That's on top of massive growth since the beginning of October. We've seen our case positivity rate in the state nearly triple. As has been the case for weeks now, this comes as Illinois sets new records in testing. Today we reported our 8 millionth test, and we're now averaging more than 82,000 tests per day. That's good news, and we're continuing to build on that. But at this point, the rate of growth in our positivity is far outpacing our growth in testing. In other words, the more we test, the more we're finding people infected with the virus. That's awful news. Offsetting that is that we're finding infected individuals earlier, both because people are getting tested when they're contact traced or when they're, exposed to someone who is sick. Both of those things, really. Don't wait until you develop any symptoms. The earlier that you test, the more likely you can limit the spread of the virus to your family, to your friends, or your coworkers. Across the state, our regional test positivity rates continue to reach new heights. Today, the region with the lowest average in the state is at 10.0%. That's Region 6, East Central Illinois. Region 1, the Northwest region, is at an alarming 15.8%, with Region 7, Will and Kankakee counties now following closely behind at 13.4%. Last Thursday, we saw a rolling average of 2,700 COVID-19 patients in our hospitals statewide. Today, that average is up over 3,400. That's up 120% since the beginning of October, when we were averaging just over 1,500 people in the hospital fighting COVID-19. Just think about that. We have more than doubled the number of people in our hospital system with this disease in just about 5 weeks, with no sign of slowing. We are just 3 weeks from Thanksgiving. We continue to see rising numbers of severe cases trailing rising hospitalization rates, which, mind you, is already a sign of severity on its own. The number of COVID-19 patients in the ICU is up more than 100% since October 1st. We entered last month with an average of 360 COVID-positive ICU patients in the hospital, and today we've more than doubled that with an average of 724. And since the beginning of October, the number of people fighting COVID-19 on a ventilator statewide climbed from around 140 to more than 300. Across the nation, we're seeing states and cities affected by this growing crisis, and they're responding by rolling back their reopenings. And over in Europe, France, England, and Germany are rising at such a quick pace that they're resorting to much more significant restrictions on all non-essential activities, as they too face case numbers and hospitalizations rising at a tragic rate. Remember that Europe fared much better than the United States over the last 5 months. So when they impose those severe mitigations, it's an indication that the virus is raging out of control there, and we are heading in a similar direction. The vast majority of people in this state want to keep themselves safe, their families and children safe, their parents and neighbors and friends safe. And they know that masking and distancing and limiting public gatherings are the right way to do it. But if others don't change their behavior, which we're going to experience, if they don't change their behavior, we are going to experience a surge in hospitalizations much higher than where we are now. And in some areas of our state, that will mean that you'll run out of hospital beds and nurses and doctors who can treat you. If the current trajectory continues, if our hospitals continue to fill up, if more and more people continue to lose their lives to this disease, we're going to implement further statewide mitigations, which nobody, and I mean nobody, wants. So we have got to get these rates of community transmission down. And the only way that's going to happen is if mayors and city councils and county boards across this state stand up and say, this needs to change. Far too many local governments across the state are failing to enforce any mitigation measures, allowing this continued rise in positivity to balloon out of control. It's time to take some responsibility. That's the only way that we will get out of this without having to implement more and more restrictions across more industries and across the entire state. Because frankly, I can tell you that these numbers are drastically increasing. And I can tell you that till I'm blue in the face. But if local leaders don't step up, if high-risk industries don't act accordingly, if families don't put off that gathering or dinner party, if people don't wear a mask, we're heading down a very dark, dark path toward where we were last spring. Let's not let that happen. With that, I'll turn it over to Dr. Ezike.
Thank you, Governor, and good afternoon. Just following up after what the Governor has shared, both in his words, graphically, the message is the same. And to follow on that, I need to talk about the upcoming holiday season, traveling to see family and friends. We just really need to think about this. Let's be clear, travel will increase your chances of contracting and spreading COVID-19. as will going to a crowded event, as will having multiple people in your home for Thanksgiving. So in terms of travel, we do recommend avoiding travel to areas of higher risk, but as you are seeing, that is almost everywhere. That includes essentially every county here in Illinois, that includes almost every state in the United States, and many countries around the world. Visiting counties, states, or other countries where there are fewer cases of COVID-19 might be a little less risky than visiting locations where there are higher rates, but there's still a risk, and there's just even the risk of just the traveling process. I want to make sure that every person watching, every person listening understands that there is significant potential for harm and death. Let's be very plain. And it's not just to yourself, for the people who feel nothing could ever happen to them, but it's to other members of your family and other people that you may not even know that you could unwittingly spread the virus to. Ultimately, the decision to travel or to have an event or to have a large Thanksgiving feast is yours to make. But I want to make sure that you can't say you didn't have all the information and the knowledge that COVID-19 is a serious disease. It's led to millions of hospitalizations and hundreds of thousands of deaths worldwide. I realize that some people may still choose to travel. Maybe you need to travel. Sometimes you'll have to travel, and in those instances, we are trying to provide guidance to help accomplish this in as safe a manner as is possible, knowing that we could never fully mitigate all the risk. So consider how you're going to travel or your mode of transportation. Obviously, when you fly, there are security lines as you go through the airport terminals. Think about a flight with layovers where it may be cheaper, but obviously that will pose more risk than a direct flight. Traveling by bus or train versus taking your own vehicle. Obviously, taking your own vehicle, if that's an option, would be safer. Traveling by bus or train, you might not be able to maintain 6 feet of distance, and sometimes that will be for extended periods of time during the journey. If you are driving your own personal car, plan out how you will do the stops for gas, for food, for bathroom breaks. Think about hand sanitizer and washing your hands frequently. IDPH has issued travel guidance and created a travel advisory map on its website. This is to help you make more informed decisions about travel if you have the choice or if you can postpone, but you can look there to see what's going on around the world. This is available at www.dph.illinois.gov/travel. We all want to be with our friends and family for the holidays. But perhaps this holiday, as we have already done for most of 2020, we are going to have to do it COVID style, and that means virtual. We'll have to stay at home and forgo the large gatherings so that we will have future events that we can be with our friends and family. Today, we are reporting 9,935 new cases. These are not duplicates. These are not people who took 5 different tests. These are new individuals diagnosed with COVID for a total of 447,491 cases. And as the governor mentioned, that includes 97 newly reported deaths for a total of 10,030 lives lost. And not that the 97 is not enough, but that includes individuals in their 20s, 30s, 50s, as well as people in their 60s and over. 3,891 people were reported to be in the hospital overnight with COVID-19, and of those, 772 patients were in the ICU, and 343 patients were on ventilators. In the last 24 hours, 86,015 tests have been reported for a total of more than 8 million tests. So as always, let me close with wear your mask, please. Wash your hands, please. Watch your distance to other people. And if you haven't already, get your flu shot. We are really at the point where we are concerned that whether you have the flu, whether you have COVID, whether you have chest pain, whether you have stroke-like symptoms, we are worried that there won't be a bed enough for everyone. So let's make some decisions now to decrease from the nearly 10,000 cases today. We can do something about the future number of cases that are identified. Thank you. Buenas tardes. Sé que todos están pensando en los días festivos y ir de viaje para ver a familiares y amigos. Quiero ser muy clara. Viajando aumenta sus posibilidades de contraer y propagar COVID-19. Recomendamos evitar viajar a áreas de mayor riesgo, que en este momento incluyen casi todos los condados de Illinois, casi todos los estados de los Estados Unidos y casi todos los países del mundo. Solo quiero asegurarme de que cada persona comprende el riesgo y el potencial de daño. Sí es su decisión, pero toma esta decisión con el conocimiento de que COVID-19 es una enfermedad grave que ha afectado a mucha gente en todo el mundo. Si tienes que viajar, es importante pensar en tu modo de transporte. Cuando volamos, enfrentamos líneas de seguridad y terminales de aeropuerto, y vuelos donde hay que cambiar aviones nos ponen en mayor riesgo de exposición al COVID-19. Viajar en autobús o tren significa sentarse o pararse a menos de 6 pies de otras personas, a veces durante periodos prolongados. Si planeas conducir, las paradas para poner gasolina, comer o ir al baño pueden ponernos en contacto con otras personas y cosas que tocamos con frecuencia. IDPH ha publicado una guía de viaje y ha creado un mapa para viajes en nuestro sitio web para ayudar a las personas a tomar decisiones informadas sobre viajes. Visita nuestro sitio web en www.dph.illinois.gov/travel. Todos queremos estar con nuestros amigos y familiares durante los días festivos, pero en estas vacaciones debemos quedar en casa para poder estar con los amigos y familiares durante las próximas vacaciones. Hoy estamos reportando 9,935 casos nuevos de COVID-19, para un total más de 447,000 casos en Illinois. Eso incluye 97 muertes adicionales para un total de más de 10,000 vidas perdidas a este virus. 3,891 personas pasaron la noche en el hospital con COVID-19, de ellos 722 pacientes estaban en la unidad de cuidados intensivos y 343 personas estaban en ventiladores. En las últimas 24 horas, 86,015 pruebas fueron hechas para un total de más de 8.1 millones de pruebas en Illinois. Y como siempre, practica por favor los 3 M's. Usa su máscara, lávese las manos y mantenga su distancia. No olviden, vayan por su vacuna contra la influenza. Necesitamos toda la protección que podemos obtener contra estas 2 enfermedades. Muchísimas gracias para su apoyo. And with that, I will turn it over to Governor Pritzker.
Thank you, and happy to take questions from members of the media. Eric?
And when we're talking about broader measures, stricter mitigations, like you've just stated, what are some of those things that look like immediately, and how far away are we from that?
Well, as I say, if the numbers keep going in the wrong direction, we will need to impose further mitigations. I think we all remember what Phase 3 looked like or Phase 2 looked like. Those are all things that are under consideration. Remember that it's the exposure that people have to one another. The way they expose themselves, in other words, wearing a mask or not wearing a mask, whether they have distance from one another, those are all the things that affect whether the virus is going to be spread, whether you're indoors in greater numbers than you should be, and so on. And so all of the things that we looked at and did over the last 6 months are things that are under consideration for what those new mitigations might look like. But let's just be clear, you can go look at all of the mitigations that we had in previous phases of Restore Illinois, or in the mitigations that are in the Resurgence mitigation list, Tier 1, Tier 2, Tier 3, which have been on the table on a regional basis. All of those are frankly, potential mitigations that we would put in place statewide.
I had a question from my colleague, John Garcia. You talked about enforcement, local enforcement.
Yes.
There's a report out of McHenry County, 90% of businesses, even if that number seems high, it's significant. Even if that number were lower, 90% of businesses not complying with the indoor dining ban. Even if local law enforcement was really trying to enforce this, I mean, when you have that many people
Oh, believe me, when one of them gets a citation, others hear about it. When 5 of them get a citation, all of them hear about it. They know that if there was enforcement, if there were actual consequences for their actions at the local level, and they're supposed to enforce state laws. You know, state regulations, state laws, that is their job. And when they don't enforce them, people die. Yes, sir.
Yesterday, Dr. Ezike said that we should be testing ourselves more and more, perhaps even if we don't show symptoms. Do we have the capacities to sustain that kind of testing?
We've been building that precisely for that purpose. We want people, in fact, it was part of my remarks today, just to remind you that even when you're not feeling symptoms, if you feel like you've been exposed to people or in an environment in which you could have contracted COVID-19 and you're not feeling symptoms, go get tested. And that's one of the reasons, I mean, frankly, that I think our state has been, over the last number of months, better off than many others, is that we have so many tests available for people to get. We want people to do it. We want people, even when you're not feeling symptoms. Look, early on here, you remember that we had to tell people, like, please don't get a test until you have symptoms, because there just weren't enough tests, right? That was very early in the pandemic. Now we're literally the 3rd largest testing state in the country. That doesn't mean that everybody can go every day and get a test and we'd be fine. But, you know, at 80-some thousand tests per day, and you've seen we've steadily increased that from, 60+ thousand, 70,000, 80,000. We're heading toward 90, 100,000. It won't be enough until we can start to get the virus under control for everybody to get a test all the time. But as I say, if you feel like you've been in a place where you may have come in contact with somebody who has COVID-19, go get tested. And yes, we have the capability to do that. Yes.
I have an off-topic question. Is that okay?
Sure, of course. I mean, unless anybody else. Yeah.
All right. This has to do with unemployment. Today, the new numbers from last week came out, and there were more than 73,000 new unemployment claims filed in Illinois, which was a 38% increase from the week before. Not all that surprisingly, considering the new mitigation efforts.
Well, and considering the situation of the national economy, too, because we've seen this happen in other states, too. Yeah.
And I'm sure a fair amount of those people, we could assume, are restaurant workers and bar workers and such, too, who may not have their jobs. But that aside, considering that's a 38% increase from the prior week, and, for example, there are still more than 153,000 PUA claims that have not been paid out yet in the system. Are you concerned about how IDES will be able to handle this second surge? And could you elaborate on anything new that's being done to potentially prepare for another round?
Sure. Well, let me be clear. IDS is in a much better position today than it has been at any time during this pandemic. Many, many upgrades have been implemented. We have a new leader at IDES. She's doing a terrific job. We've brought in technology to help us with processing to make sure that we're answering, calling back people much faster. Obviously, any increase in unemployment claims is tragic for the people who have to endure that, and it makes it more difficult to catch up and make sure that we're responding to people very quickly. But people are getting called back, and they are getting their unemployment claims met. More is worse for our state. More is worse for our state. There's no doubt about it. I also want to be clear that you talked about the PUA system. That system is rife with fraud all over the country because the federal government set it up wrong. And so there are literally weekly calls among all the states to discuss how they're going to manage dealing, the FBI is involved in this, the Justice Department is involved in this, our Attorney General's office is involved in this. It's a huge system that got created with, frankly, that's allowed people to, using stolen identities or, trying to figure out somebody's name and using it in a PUA application. And so to the extent that people are not getting those PUA, benefits filled, one of the challenges has been the massive fraud that the federal government kind of built into that system, and that's going to have to be worked through in every state, and every state is working on it. We're actually in a slightly better position dealing with that than many others.
And a quick follow-up, are
Yeah.
you concerned about the state's ability not to pay out the claims, but to pay for them? I mean, I understand there's a trust, correct?
Well, the PUA system is all federally funded.
Okay.
So the answer is, my concern is that your federal tax dollars were wasted by the fraud that was built into that system.
And regular unemployment claims, are you concerned about the state's ability to absorb that cost?
Well, I'm concerned every state's got the same problem. Every state has massive unemployment claims that it's paid much more than they expected. We too have that problem. And so, we'll work our way through it. It's certainly help that we'll need from the federal government to support unemployment for every state and for the state of Illinois as well. And obviously, we have an agreed bill process to work through business and labor working together to make sure that system is solvent.
Just to follow up on the stricter mitigation. Sorry.
Yeah.
I'm good, thank
You're
you.
good, okay. On the possibility of stricter mitigations.
Yes.
You said in the past, it takes a couple weeks for the resurgence mitigations to take hold.
It does.
And really evaluate that. Are we in a place where you are evaluating what's been happening?
Yes.
And you think that the resurgence mitigations are not working?
Well, it is clear that the numbers continue to go up, even in places where we put those mitigations in place a couple of weeks ago or 3 weeks ago. And so as we watch those numbers, again, nothing's exact here. This virus doesn't follow an exact path or timing. But 2 to 3 weeks, and I look to Dr. Ezike, 2 to 3 weeks is at least a time in which you can start to see, is there a bend in the curve? What's happening? By the way, the virus, it doesn't slow down. The virus does what it wants to do. The question is whether people are following the mitigations that have been put in place. If they're not following the mitigations that are put in place, then no mitigations that you announce, or if you don't enforce them at the local level, like we were talking about earlier, guess what? And if people aren't following them themselves, which is much preferred, enforcement is, your secondary measure. People should just do the right thing here for themselves and their families. And ultimately, we do believe these mitigations work, but people have to follow them. And I think that, just as importantly, some mitigations are less effective than others. Obviously, we saw back in the spring a complete stay-at-home order, not something right now that we're considering, but that worked, right? You saw that from the moment we put it in. Remember, it took 6 weeks from the moment we put it in for us to see a peak, and then begin to come down the other side. You remember? And it was about March 21st to about May 6th. Now, that's to get to a peak, right? You can see in the middle of it whether the curve is bending. And then you want to hit a peak and start going the other side. We're looking for the curve to bend. Right now, it's in a linear fashion heading up.
All right, we got to get to some questions from the internet. John O'Connor is asking, Wednesday, you said you ran for governor to handle the budget responsibly because revenue never matched expenditures. Then you signed a budget with a $5 billion gap, hoping for federal aid that hasn't come. Was that responsible? Why should taxpayers believe you can fix this now?
Well, I don't think anybody thought when I was running for governor, nor did I, that we would have a pandemic that would take billions of dollars out of our state budget. And I did balance the budget for 2020. I balanced that FY 2020 budget, and we were running ahead on that budget. We actually had a surplus running under the budget that I got passed. But along came a pandemic, and that'll put a multi-billion-dollar hole in anybody's budget.
This is from Rich Miller at Capital Facts. I'm hearing increasing anecdotal reports of long lines at testing stations. Representative Deb Conroy related a story today. Is there any evidence that this is a widespread problem, or is it confined to certain areas, and what's being done about it?
I would say whenever we discover that there are long lines, untenably long lines, obviously if people have to wait a little bit, that's not bad. If they have to wait hours, that's bad. Whenever we hear about those, we start to increase testing capability in that area. Sometimes we move mobile assets into the area. Sometimes we go to the hospitals or other medical providers and ask them to start or expand implementing them. The fact is that we're trying to react wherever we see that, and when we hear about it, it's not a good thing, right? It's something we want to address everywhere in the state if we hear about it, and I hope people will report that to us.
Dave, Tony at WBZ, and a few other people are asking about Senator Durbin's comments yesterday, and if Speaker Madigan should remain chairman of the Democratic Party in Illinois, and what role do you think his investigations played in voters rejecting the fair income tax?
Look, I agree with Senator Durbin that, opponents were able to tap into voters' concerns about corruption and their lack of trust in government. There are real challenges there, and that I have proposed significant ethics reforms that I know that the legislature needs to take up. The Republicans and the billionaires that sided with them were, effectively able to use the speaker as their foil, and that hurt our state's ability to get things done. And the truth is that Democrats are standing up for the middle class and getting important things done to support them. But it is clear that Senator Durbin is expressing something that I think is accurate.
Does the state still intend to borrow money from the Fed's MLF program, and if so, how much and when?
It's a good question. First of all, with the fair tax being defeated by the Republicans and the billionaires, the fact is, as I have said, we're going to have to make drastic, really painful cuts, and that's just the kind of immediate challenge of the budget. And then add on top of that the failure of revenues from COVID. And so the MLF will no doubt have to be part of the solution, but we need to make other structural changes, and I've asked the leaders to step up, and I mean of both parties, to step up with proposals to do that.
And we have a follow-up question. To be clear, you agree with Senator Durbin that we need new leadership at the party?
Yes.
Jim Leach is asking, with local governments still defying orders to close indoor bar and restaurant service, at what point do you step in and assert your authority to address a statewide public health crisis?
I'm sorry, can you repeat the first part of that question?
With local governments still defying orders to close indoor bar and restaurant service, at what point do you step in to assert your authority to address a statewide public health crisis?
Well, if they are not enforcing those local mitigations, then once again, moving the state backward, which is bad for every industry and bad for every individual in this state, frankly, other than it's going to bring down these metrics and these positivity rates and cases, which will be good for everybody. But if you want to keep the economy moving forward, they ought to go enforce the mitigations that we put in place.
Shruti at Bloomberg and Jamie at the Tribune both have similar questions. How soon could we see a hospital bed shortage occur in Illinois, and in what regions are we worried about? And are there any plans to build any alternate care sites or open any of those?
I think that's all on our website. You can see what the capacity is, I think, in every region on the website, hospitalizations, capacity levels. So that's all available to you. Please go to the IDPH website.
I think we got almost everything. Let's make sure. Yeah, I think that looks like everything.
Great. Thank you, everyone.